Excuse me, doctor. Thank you for making time to see me. I've been sitting in the waiting room now for 2 hours, and I am feeling very, very bad.
That sounds rough. What seems to be the trouble?
My body part, my back, it hurts very much, and it has been hurting since a long time ago. I think maybe 3 months now.
And what kind of hurt is it? Is it a sharp hurt or a soft hurt?
It is a strong, hard hurt,
Yeah.
and it comes and goes, but when it comes, it makes me not able to stand up straight. I need medicine now. Strong medicine.
Wait, stop. Okay. I am sorry, but as your expert guide on this deep dive, I have to interrupt.
What to eat? Why?
You've been waiting for 2 hours, you're clearly in distress, and you just told the doctor you need strong medicine. But, based on your English, that doctor's probably thinking you have a mild strain.
A mild strain.
Yeah, something that, can be treated with rest and maybe some over-the-counter pain relievers.
But I just told him it was a strong, hard hurt that keeps me from standing. How can he think it's minor? I use the words very much. I even said it has been 3 months.
And that is the catastrophic failure of communication right there.
Uh-oh.
You use textbook grammar, sure, but you failed to communicate the functional reality of the crisis. When we say it hurts very much since a long time, that phrasing is just too vague.
Hey,
Yes. It suggests something chronic, maybe manageable, not an acute emergency that needs immediate attention.
I was trying to communicate urgency, but my old, polite English completely failed me. I was in agony, and I was misunderstood.
Okay, let's unpack this and solve the agony problem. Have you, the listener, ever been in a high-stakes situation, maybe at a pharmacy, a hospital, or even just talking to a gym instructor,
I bet you have.
where you tried to use what you thought was correct English, only to be totally misunderstood, making the situation, confusing or even embarrassing?
I know I have.
Welcome back to this deep dive, the place where we learn English effectively.
I had fun doing it. Today we are focusing on health English mastery. This is so important.
It really is. We're pulling insights from global language resources and specialized beginner courses to give you the practical, real-world phrases you need for when the words truly matter. From describing symptoms to understanding complex dosage instructions.
So we never have to make that embarrassing mistake again.
Exactly. This deep dive is designed to make sure of that.
This sounds absolutely critical. Before we dive into fixing my fictional catastrophic back pain, tell our listeners what they need to do first.
Absolutely. We have a lot of detailed, functional vocabulary coming up, and you need to be ready to process it. Please hit like and subscribe to our content right now.
Do it.
Your support helps us create more of these deep dives that take you from vague textbook descriptions to clear, confident, and life-saving communication.
Okay, let's get into it. The reality check. Why did my English fail so badly?
Okay, so it all comes down to understanding the fundamental difference between social English and functional, what we call high-stakes health English.
I thought English was English.
Yeah,
What's the fundamental difference?
the consequences.
The consequences. Okay.
Right. If you accidentally use the wrong idiom at a dinner party, the worst that can happen is, what, a little embarrassment?
Yeah, maybe an awkward laugh.
Exactly.
Yeah.
But if you use the wrong word when you're describing a sudden, severe allergy to a paramedic, the consequences are, well, they're very serious.
Life or death, even.
Potentially.
Yeah.
Unlike casual chat, medical communication is inherently transactional, it's urgent, and it carries significant real-life consequences if you're misunderstood. We're talking about getting the right diagnosis, the right treatment, the right dosage.
So the goal isn't just to speak English. It's about performing a specific action successfully.
Exactly. The primary goal in this context is achieving functional capacity. Can you successfully report pain? Can you identify your symptoms? Can you comprehend complex medical instructions? It all requires precision.
And that's where the stress comes in. When you're in pain or the doctor's speaking really fast, what happens to your brain?
Oh, what happens to yours?
I freeze, 100%. I forget even the simple words, and I start translating word for word in my head, and it's a disaster.
That freezing is a concept in second language acquisition called a high effective filter.
A high wit?
Effective filter. Think of your brain's language center as a finely tuned computer. When you introduce stress or fear or anxiety like being in a hospital, your brain throws up a protective firewall.
The firewall sounds terrible.
It's effective protection, but it's terrible for learning. When your filter is high, your cognitive energy is spent managing anxiety instead of processing the language.
Okay, that makes sense.
So for beginners, especially at the A1 or A2 level, this filter just plummets your ability to both understand and speak. The key insight here is that we have to deliberately reduce that anxiety by making the English we hear manageable.
Right. My old textbook English is way too slow and robotic, but when native speakers talk, it's too fast and too complex. How do we bridge that terrifying gap without making my affective filter explode?
That brings us to the necessity of comprehensible input.
Comprehensible input.
The input you receive has to be slightly beyond your current level. That's the famous I+1 concept. But it must remain accessible. And for listening, accessibility means managing two things: complexity and rate.
Rate meaning speed, and complexity meaning the difficulty of the word.
Precisely. And this is where institutional strategy comes in. When you're dealing with complex, high-stakes topics like health, major educational organizations cannot afford misunderstanding. The sources confirm that some organizations make a deliberate strategic choice to read their content about health and medical topics 1/3 slower than standard everyday English.
1/3 slower.
Wow.
That's a huge commitment to managing what you call cognitive load. Why exactly did they do that?
It is all about managing that load. A standard English speaker can process about 150 words per minute.
That's fast.
It's very fast for an A2 learner who's trying to decode new vocabulary, new grammar, and cultural context all at once. It's just overwhelming. By slowing the speed by 1/3, that clear, controlled English acts as a kind of scaffolding.
Scaffolding,
Right.
like for a building.
Exactly. It gives your brain extra milliseconds to, 1, identify the unfamiliar word, 2, retrieve its potential meaning, and 3, map it onto the sentence structure.
So the slow input is the strategic way to keep that effective filter low. It lets us focus on the structure and the new words rather than just struggling to keep up.
Exactly. It moves the focus from effortful decoding to meaningful comprehension. So if you, the listener, feel overwhelmed by fast native speakers, you should seek out material that is explicitly designed to be clear and controlled.
And use transcripts.
Yes, use multimodal support like transcripts. They are indispensable for cross-referencing the sound you hear with the word you see. It really helps cement that vocabulary.
Okay, so I need clear, slow input, but I also need to make sure I'm turning that slow understanding into fast, usable speech for an emergency. I listen to deep dives all the time while driving or cooking. Is that enough?
That process, listening while you're distracted, is called passive listening. And it's crucial for building receptive skills. Your ability to understand the language, it builds up a massive bank of words and phrases you can recognize. But passive listening alone doesn't guarantee productive output. Your ability to speak fluently and retrieve those crucial phrases under pressure?
I know that feeling so well. I recognize the word when I hear it, but I can't find it in my brain when I need to speak it. It's so frustrating.
To bridge that gap, you need active effort, or what we call smart work. You have to move the language from your recognition memory to your production memory.
And for functional English, that means training my mouth muscles and my brain at the same time.
Exactly. Training your mouth and your auditory processing simultaneously.
Okay, tell me the critical technique. I need to train my mouth muscle memory.
The foundational technique is shadowing.
Shadowing.
It's auditory mimicry. You listen to a native speaker say a sentence or a phrase, and you immediately repeat exactly what they say. But critically, you have to copy the rhythm, the intonation, the music of their voice.
Not just the words.
Not just the words. Resources specifically mandate shadowing practice for life-saving medical English because it optimizes retrieval speed. When you're in the emergency room, you don't have time to think. The words have to come out instantly.
Shadowing sounds intense. If I find a phrase like, I have severe abdominal pain, how do I lock that into my memory using active effort?
We use the fundamental principle for maximum retention. Pause. Write. Repeat.
Pause, write, repeat.
Okay.
You hear the functional phrase on a deep dive. First, you pause the audio. Second, you write the complete new word or phrase down in a special English notebook.
Got it.
Third, and this is the most important part, you repeat it out loud immediately, several times, focusing on that native rhythm.
Why the triple action? Pause, write, repeat. What's the magic there?
By engaging three primary senses,
Hmm.
auditory from hearing it, visual from writing it, and kinetic from saying it and writing it,
Yeah.
you create this dense network of associations in your brain.
Ah, I see. It's like attacking the memory from all sides. Exactly. This multisensory input bypasses that high effective filter and facilitates faster retention. It actively consolidates that complex, high-stakes vocabulary into your long-term memory.
So passive listening is the start, but active multisensory effort is the engine of rapid learning.
You've got it.
I understand. I am ready for active effort. My notebook is open. Let's start the upgrade game. I need the functional power phrases that would have saved me at that clinic.
Excellent. Let's shift gears and focus on the practical sentences that instantly convey clarity and precision.
I'm ready.
Upgrade 1. Emergency and pain intensity. Let's go back to that scenario. You're in the emergency room. Sudden, agonizing pain. You need to communicate two things immediately: how bad it is and the nature of the crisis. What is the single most functional sentence to use?
Okay, I need to use the words severe, but I want to add more detail.
Okay.
Is it the pain is severe and I think I might collapse?
That's close, but we need the transactional language the staff uses for triage. Triage is the process where they decide who needs help first, so you need to speak their language. The essential formula for urgency is, I have severe abdominal pain. On a pain scale of 1 to 10, this is a 9 out of 10.
Severe pain, 9 out of 10. That immediately sounds like I know what I'm talking about.
Yep.
But why does the number matter so much?
It's the lingua franca of emergency medical services. It's their common language. A story I read from a medical professional detailed how non-native speakers often rate their pain as a 3 or 4 because they feel like they're being polite.
Or they don't want to be a bother, if I
Uh-huh.
can relate to that.
Right. But if you're truly in distress, using a 3 places you way down the waiting list. A 9 or a 10 on the pain scale is a signal that requires immediate resources. It's transactional. It buys you time and attention.
So it's not about being dramatic. It's about using the right coded language. Okay. What if my pain is the worst I've ever felt?
You can use phrases that reinforce that severity. You can try, this is the worst pain I've ever experienced, or the pain is unbearable. These are high-level urgency markers.
Unbearable. That's a strong word.
It is. And furthermore, you must describe the nature of the pain, not just the intensity. This helps the staff narrow down the potential cause.
The nature of the pain.
Yeah.
Okay. What are the different natures of pain I should know?
We have 3 main categories. First, sharp and shooting, which often indicates nerve pain or acute inflammation. Think kidney stones or appendicitis.
Ouch. Okay.
Second, dull or achy, which suggests muscle strain, a headache, or a chronic slow issue.
Got it.
And third, throbbing or pulsing, which suggests inflammation or maybe a severe migraine. For example, instead of just saying my head hurts, you should say, I have a throbbing migraine on the left side.
So the difference between dull and shooting could literally save hours of waiting time. I'll make sure to practice. The pain is searing in my chest and it feels like a 10 out of 10.
That is functional capacity mastered. Now let's move away from the emergency room to the routine checkup.
Okay, less drama.
Right. Upgrade 2. Describing symptoms and duration. You go to the regular doctor for a lingering issue. You need to clearly explain what hurts and how long it's been happening with grammatical precision. So give me the best natural way to talk about having a cold.
I should probably avoid saying I have a fever and this stomach pain since that's too generic.
Exactly. Too generic. The essential formula here is, I think I caught a cold and I've had a sore throat for 3 days.
Like caught a cold. It sounds so natural. I'll use that instead of I have a cold.
Both are fine, really, but caught implies the onset, which is often useful information for a doctor.
Right.
But crucially, always distinguish the severity. A cold is typically a mild, stuffy nose, a slight cough. The flu is much stronger. It involves a high fever, generalized body aches, and extreme fatigue. Doctors treat those two very differently.
Mislabeling a cold as the flu can waste valuable resources. That clarity is vital.
It is.
Now let's address my original grammar error. My back hurts very much. You said I was mixing up the roles?
Hmm.
Let's drill down on the ache versus hurts distinction.
This is a core linguistic distinction. The rule is simple, but learners often miss it. We use the word ache for internal, continuous, or generalized discomfort, usually in the head, stomach, or back. You can't see the origin of the pain.
So I say headache, stomach ache, backache, and maybe toothache.
Precisely. But when the pain is focused on a limb, the neck, or a specific external point that you can point to, and it often implies an injury, we use the verb hurts.
Can you give me some examples?
Sure, my neck hurts, my knee hurts, my shoulder hurts. You would never say, I have a knee ache.
Ah, I see.
The distinction ensures you sound natural and communicate the correct type of discomfort, internal and chronic, which is ache, versus external and acute, which is hurts.
I have a headache, but my arm hurts. That is a great rule of thumb.
Now for the grammar essential, duration. When you're discussing medical history, the doctor needs to know if the symptom is current, or if it began in the past and continues up to this moment. For this, the present perfect tense is non-negotiable.
I always struggled with present perfect. It's so tricky.
We use two key markers. We use since when we talk about the starting point of the issue. For example, I've had this rash since last Tuesday. The action started Tuesday and hasn't stopped.
Okay, since for starting point. And we use, when we talk about the length of time or the duration.
Correct. I've been feeling lightheaded for 4 days. If you use the simple past, like I had a cough last week, the doctor might think the cough is now gone.
Right, they'd think it's over.
By using the present perfect, you're clearly saying the problem is ongoing and it is present now. This grammatical clarity is functional and crucial for an accurate diagnosis.
I've been practicing yoga for 3 months. I've had a dry cough since Saturday. I am getting the hang of this.
You absolutely are. Now let's move to a place where precision is not just important, but truly life or death.
Ooh, the pharmacy.
Exactly. Upgrade 3. Navigating the pharmacy. Dosage. You're at the chemist filling a prescription. The pharmacist is often rushed. You must ensure you understand the instructions perfectly. So what's the best way to repeat the dosage back to the pharmacist to ensure zero misunderstanding?
I should probably read the label, but I get lost in the numbers and abbreviations. I would probably ask, is this 1 time or 2 times to take?
Good attempt at clarification, but we need to master the high-precision language of the bottle. The essential formula for understanding instructions is recognizing the specific sequence. Take 1 tablet 3 times daily, TID, with food for 10 days.
Okay, that's specific.
And you must know how to respond instantly to the most critical safety question. Do you have any known allergies to medicine?
That's a big one. Let's break down the prescription vocabulary. What are the common names for the medicine itself?
The solid forms are usually tablets or pills. If you have a cough or a sore throat, you might be prescribed lozenges, those small hard candies you suck on, or syrup, which is the liquid.
Right.
And remember, the pharmacist can't give you powerful drugs like antibiotics without the doctor's official order, which is the prescription.
And those confusing abbreviations I see on the bottle, they always trip me up.
The medical abbreviations are everywhere, and understanding them is functional capacity in action. QD means once daily. BID means twice daily.
Twice daily. BID. Got it.
And the most common one, TID, means 3 times daily. You must know these time markers cold.
And the difference between taking it with food versus on an empty stomach, that always seems important.
It's very important. It's often related to absorption and stomach upset. If the instruction is to take it with food, it means during or immediately after a meal to buffer the effects. If it says on an empty stomach, it means you have to take it before eating or several hours after your last meal.
A quick, clarifying question could save a lot of trouble.
It could. Asking, should I take this before or after breakfast, can prevent an upset stomach or, worse, a reduced efficacy of the medication. This level of detail elevates your communication instantly.
This is functional clarity. Now, for something a bit less serious, Lifestyle and fitness.
Right. Upgrade 4, fitness and body movement. Your friend asks about your gym habits. You want to sound active and engaged, not like someone reading a manual. How do we talk about exercise naturally?
I often say, I practice the sport,
Ugh,
but I feel like that is way too formal.
it is. The verb we need is much more colloquial. The essential formula for fitness talk is I work out 3 times a week, I focus on resistance training and try to increase my lean muscle mass.
Workout sounds perfect. What are the other key verbs I should use for activities?
Use active, natural verbs like workout, which is the general term, or go jogging, do yoga, go swimming, or ride my bike. Avoid overly complex verbs when the simple one works best.
And when I talk about the gym itself,
You need location and equipment names. The place with the running machines.
yeah,
That's the cardio section. It features the treadmill, the elliptical, and the stationary bike. The area with the weights is the weight room or free weights section.
and the weights themselves?
Know the names. Dumbbells are the handheld weights and barbells are the long bars.
What about the exercises? If I want to tell my trainer I did a full body workout, what words should I use?
Use the functional verbs for movement. I did 10 squats to train your legs. I did some lunges, which is stepping forward. I held a plank for core strength. These are specific and immediately understood.
And safety.
Critically, you need the language for safety. Always warm up before and stretch afterward.
And if I hurt myself, just a little bit, how do I describe a minor injury?
Use precise language. I think I pulled a muscle in my back, which is a mild tear or strain, or I sprained my ankle when a joint twists.
Okay.
And if you feel good after, you can say you have a good tired but energized and strong. It conveys a positive outcome from the physical exertion.
Well, I'm going to tell everyone I pulled a muscle while doing squats just so I can use the new vocabulary.
That's the spirit. Now let's wrap up this section with what sustains the entire operation: nutrition and
The
wellness.
fuel for the body.
Exactly. Upgrade 5, nutrition and wellness. When talking about daily habits, you need vocabulary that describes balance and commitment. How do we talk about healthy eating without sounding boring?
Hmm. I would probably say I eat good food and try to be careful.
We can be more specific. We need to sound more specific about the choices we make daily. The essential formula for natural wellness talk is I eat lean protein every day and I'm actively cutting down on processed food. I believe in everything in moderation.
Cutting down on is a great functional verb phrase. I like that.
It is. It indicates commitment without claiming perfection. Start with the core vocabulary for food groups: fruit like berries and apples, vegetables, especially leafy greens like spinach and kale,
Right.
lean protein, which is chicken, fish, eggs, and beans, and whole grains like oats and brown rice.
And how do I talk about what I'm trying to avoid?
Use phrases like, I'm avoiding processed food, or I am trying to limit my sugar intake. Notice we use the adverb, I try to eat healthily. While I eat healthy is common, using the adverb healthily signals higher proficiency.
A little grammar upgrade there.
And the core philosophical concept is balance or moderation.
Like the 80-20 rule, where 80% is healthy and 20% is, fun.
Exactly. It's an essential wellness concept to communicate. And finally, we cannot talk about health mastery without talking about sleep. The sources consistently highlight that adequate rest aiming for 7 to 8 hours is not just passive recovery.
It's active.
It is actively crucial for memory consolidation and sustained focus, which directly impacts your English learning speed.
Wow. 5 massive upgrades.
Yeah.
From severe pain, 9 out of 10, to using present perfect for duration, to understanding by and TID, to pulling a muscle, and finally cutting down on processed food. I feel ready for life now.
You should feel confident, but that confidence must be balanced with caution. We have reached the danger zone,
Dun 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 dun.
where we look at specific linguistic traps that can undermine all the functional capacity you just built.
I know my brain sometimes goes to the dark side. What if I use Google Translate for a word like constipation or, dysmenorrhea before I go to the doctor? I want to sound highly educated.
I must issue a critical and absolute warning. Do not use Google Translate for highly specialized professional medical jargon. Avoid it entirely at the beginner level.
Really? Why? Isn't a bigger vocabulary always better?
In this context, no. Jargon is the enemy of the beginner. There are resources that cover intensely specialized subjects like roundworm vocabulary or breast cancer vocabulary. This technical language is meant for B2 plus healthcare professionals, doctors, and nurses who have the full context.
So if I walk into the clinic and proudly declare, I am experiencing acute spasmodic dysmenorrhea, the doctor will know immediately I use Google, and he might doubt my entire story.
Precisely. And more importantly, exposure to that technical language creates a massive risk of lexical overload for A1 or A2 learners. When you memorize words you can't easily contextualize or use naturally, the frustration raises your affective filter and guarantees communication failure.
So stick to simple, functional phrases.
Exactly. I have a lot of stomach pain, I feel very hot, or it's painful when I stand up. Simplicity guarantees clarity.
Jargon is the enemy of the beginner. Lesson learned.
Now, let's talk physical training. We mentioned that your mouth needs training like a muscle. What's the single biggest physical challenge for non-native English speakers that requires disciplined daily muscle memory practice?
Oh, it has to be the infamous TH sound. I can't just use an S or a T sound instead.
The TH sound, as in think that, requires you to place your tongue between your teeth and push air out. This is physically awkward for many because it uses muscles many languages don't engage. If you ignore it, your speech will sound forced and can be difficult to understand.
So it's like a gym for my mouth.
It is. This must be practiced like any fitness routine, 5 minutes daily, to build the muscle memory required for natural, smooth speech, the melody of the language.
So shadowing isn't just about the words. It's about copying the music, the rhythm, and the tongue positioning.
Exactly. You must practice the rhythm and the concept of blocks of language. Native speakers don't say 5 individual words, they blend them into one smooth sequence. For example, instead of, would you like some coffee?
You say, would you like some coffee?
Right. We treat would you like some as one smooth rhythmic unit. This practice makes your speech faster, smoother, and instantly more natural, which in turn reduces your anxiety.
That's a fundamental shift in perception, seeing sentences as melodic blocks. But what happens if, despite all this training, I freeze? I forget a word like stethoscope when talking to the doctor, and my brain just stops.
That is the common and frustrating translation block. The natural instinct is to stop, panic, and try to retrieve the exact word by translating it from your native language. The solution is immediate. Stop translating word by word.
So what do I do instead?
You must paraphrase, describe the missing word using other simple English words you already know.
So if I forget stethoscope, what do I say?
You say, "Doctor, where is the thing you use to listen to my heart and my breathing?" The goal is being understood. You have 99% of the vocabulary you need to describe the 1% you forgot.
That is a massive confidence builder. I don't have to be perfect. I just have to be understood and keep the conversation moving.
Correct. Good communication means being understood. And the final tip to start building that confidence is to begin thinking in English.
I've heard this before.
Use simple sentences about real, immediate actions to narrate your own life in your head. If you do this daily, your brain will switch from translation mode to production mode, speeding up your retrieval and lowering that affective filter dramatically.
Okay, that was a lot. Let's wrap this up.
Okay, let's do a rapid-fire synthesis, the 5 functional categories we mastered today for high-stakes health English.
1. For urgency, use standardized markers like severe pain, 9 out of 10, and describe the pain nature. Is it dull or is it shooting?
2. For symptoms and duration, say you caught a cold, use the ache versus hurts rule, and apply the present perfect accurately. I've had this symptom since Monday.
3. For dosage at the chemist, understand high-precision time markers like TID, 3 times daily, and be able to ask about taking medicine with food or on an empty stomach.
4. For fitness, use natural verbs like work out. Know your gym vocabulary like dumbbells and treadmill, and understand how to describe minor injuries like pulling a muscle.
And 5. For nutrition and wellness, focus on core groups like lean protein and whole grains. And remember that Everything in moderation is the key to balance.
Excellent synthesis. The core message here is that you, the listener, don't need academic fluency. You need functional capacity. Focus on active practice using the pause, write, repeat method, and consistently seek out clear, controlled input to manage your cognitive load.
I feel ready to confidently describe my worst symptoms now, and I know exactly what to say at the pharmacy.
Now, here is your challenge for today, listener. So, the next hour, narrate your internal life entirely in English. If you're preparing a meal, think, I am cutting down on sugar, so I will add more leafy greens.
Ooh, I like that.
If you take a short walk, think, I need to stretch my legs after sitting too long. Apply the new phrases immediately.
And if you enjoyed this detailed deep dive, please give us a like and subscribe. We love helping you master English confidently.
And a final provocative thought for you to chew on, pulling from our wellness section. Remember that your brain requires rest to consolidate all this learning. Therefore, rest is active. A happy, rested brain is a fast, efficient brain. Prioritize your well-being alongside your study schedule.